ISAAW was founded by a dozen women from across the state, each with unique South Asian American experience, and seeks to bring other South Asian American women together to promote community engagement and public service in New Jersey. There's a huge disparity in equal representation on boards and commissions, and there is a greater disparity when looking at how South Asian American women occupy or are considered for these positions. ISAAW aspires to serve as the bridge and support network for advancement of South Asian American women in public service. Recently, ISAAW hosted a virtual panel on getting New Jersey vaccinated. Here is the story.
Perhaps if I could just start with Dr. Adinaro, because I know you've been dealing with this on a daily basis, to just speak a little bit about the common side effects that people should have when they get the vaccine. A lot of people just want to know, is it going to make me sick, and how am I going to feel when I'm done?
Sure, and just want to say good evening, everybody, and appreciate being invited to come join you all. Most of what we're seeing as common side effects are localized. It's pain at the site of the injection, arm pain. We do have some people who report some other symptoms, including fatigue and body aches. There's some evidence that the booster dose, so the second dose, will create a few more of these side effects, which are really just the immune response that the vaccine is generating in your body. And we've had very few cases of serious reactions. Most of them being around an allergic reaction or something along those lines. They have been incredibly rare, and most of the more serious ones being on the order of fewer than one per 1,000 or even 10,000 injections so far in New Jersey.
So I think that's all very good news, and should, I hope, make people feel better about being confident to get the vaccine. I'm wondering, Dr. Murthy, if you would like to speak at all to within the South Asian community, are there particular concerns either towards the vaccine, a specific vaccine itself, or vaccines in general, that we should be addressing and working to break down barriers?
South Asians in particular, there's a lot of confusion because data that's coming from India and that region looks like maybe mortality is low or, compared to other population. That is not always what we are seeing in the data coming from UK and other big national healthcare systems where, close to 100 million people are studied. So what we have to know is we do need to consider ourselves to be high-risk population for various reasons. One, obesity is not diagnosed at the right level for the South Asians because our cutoffs are very different. So many people who are obese are not aware that they are obese or overweight, or diabetes diagnosis, hypertension diagnosis has happened because people aren't getting routinely screened for these diseases. So South Asians are at risk at an earlier age, at an earlier weight, at a lower weight compared to other population. So not considering that and worrying about the side effects of vaccine, whereas not considering the seriousness of the illness is not wise, right? If you talk to your own doctors, and if you talk to all the doctors in New Jersey, I don't know many doctors who are not taking their vaccination. Why are they all open to taking the vaccination? We have to ask, because they have seen the difficulties in the hospital, and every single day we have supported multiple members of multiple South Asian families to be in various parts of the hospital with various levels of complications. We are not trying to cure COVID-19, but we don't want you all to end up in the hospital. We don't want you to all have complications. So this is a way to address COVID-19 with the most possible solutions we have right now. It's not perfect, but we need to be open to it. We need to do whatever we know right now, whatever is accessible to us to prevent it. And ideal solutions or optimal solutions will come. Right now, not having a lot of doubts, fears, anxieties about well-researched vaccines is important. And to be open to taking it and taking it promptly when it's available to you, and not nitpicking about Pfizer versus Moderna. What is the minor side effect profile difference? Should I wait for J&J vaccine and so on? Isn't wise. Again, what's available to you locally, easily, is well researched, and just follow the direction that the state is giving us.
I had a couple of questions for you, but let me just first start with this issue of communication and talking to people and kind of, we at the state realize that we have a certain responsibility to provide information, but sometimes the more local you get, the better the information is received. So I think a two-part question for you is, what do you hear and see in Middlesex of questions that are coming up? And what is Middlesex County, as an example, doing to help facilitate the vaccine program? Because we know the counties are very engaged and involved in this.
Until January 21st, Middlesex County had its own registration site. Many of the counties did. But as of January 22nd, we transitioned to the state site. We made a decision because the infrastructure, assuming we are going to get more vaccine dosages, the infrastructure we really feel strongly it has to be coalesced into one system to make everything move, fairly and efficiently. So there's these two overarching issues: getting it distributed throughout the state fairly and efficiently. And so right now, if you were to go to the Middlesex County site, and we've made it very clear, we have areas with COVID-19, you go to that page, and we have testing links because we're still testing all over the county. We have multiple sites where people can come get tested, and we have mobile units. So that's still going on while we're also trying to get the vaccine out to people. So when you come onto our site now, if you are trying to register for the actual vaccine, there's a link and it takes you to the state site. One of the things we've made a commitment to in Middlesex is right now, if there's still issues while they're working out the bugs on the state site, and also because we're aware there are people who don't have access to the technology, right? They don't have cell phones, or they don't have computers, or they're not savvy with them. There are a lot of our members of our senior population who aren't really good at this stuff. Not everybody has, grandkids at the ready to get their grandparents through the sites. So we made a commitment in Middlesex County, and I know a number of other counties have done this as well, since I've been in touch with county commissioners from different parts of the state. There's a number that you can call into to Middlesex County's health department. And we have that being manned 9 to 4, I'll say 9 to 4 or 8:30 to 4, 8:30 to 4. You can call in and ask questions, but if you also need help registering, there will be someone on the other line who will do that with you, who will walk you through that. And if you don't have the computer, they will be on a computer and they will register you. So that's a commitment we've made. Another big question we've had recently is people who are concerned because they might have gotten the first dose in a Middlesex local site. Because as Deborah mentioned, there are 6 mega sites, and one of the mega sites happens to be in Middlesex at Raritan Center in Edison. That's a fully state-run site. But Middlesex County, like many of the counties, we have separate sites throughout the county. We have the capacity to operate 6 simultaneously. We have not been doing that yet because we don't have enough vaccine. So we've taken different periods of time. In 1 week, we might open a center in Piscataway for several days. This past week, we opened one in East Brunswick for the first time.